Hi everyone, I'm Alexandra, I'm the French Communication Manager, and I'm very pleased to welcome Christine Hannon, the CEO of MyLifeCare. How are you, Christine?
Very good. Thank you, Alexandra.
Thank you for joining us. The last time we saw each other was at the Agentforce World Tour, where you presented the first AI agent for health coaching that you and our teams built together. And this is the success story we are going to talk about. And to begin, could you introduce MyLifeCare?
Well, first of all, thank you for Alexandra for the opportunity to speak about MyLifeCare and also our great collaboration with SQLI. What is MyLifeCare? Well, MyLifeCare is a truly revolutionary solution in preventive healthcare. Our mission is to keep people in the workplace as healthy as possible, as long as possible, and improve their well-being, and basically enabling them to become the CEO of their own health. Now, this was done in collaboration with a very well-known doctor who's an expert for 30 years in preventive and longevity medicine, the Dr. Christophe de Gégère. And it includes basically a detailed health assessment of the person in our clinic, a global health survey, and also human and AI coaching to help everyone meet their health goals. First of all, I would like to, before going into more detail, I would like to ask, mention two key indicators, health indicators within society today. There is lifespan and health span. Now, lifespan is the amount of time a person lives, how long their life is, and health span is the time that a person's life is spent being healthy. And in France, the average lifespan is 85 years old. And Alexandra, would you happen to know what the average health span is in France?
No idea.
It's 65 years old. That means that there's 20 years that people are going to be living with chronic illnesses and living less than, I would say, optimized lives. And this can be avoided due to prevention. And that's basically what our goal is to increase health span within the public. And now, how does MyLifeCare help people keep and stay healthy? Let me ask you a question, Alexandra.
Yeah.
How old are you?
I'm 31 soon.
31,
Yeah.
31. Now, that is your chronological age, but actually you have two ages. You have a chronological age of 31, and also you have a physiological age. The physiological age is the age of your own body and how it's growing older. And MyLifeCare is able to determine by medically and scientifically valid procedure in our clinic what is your physiological age, and it is really a KPI, an indicator of your global health. And this is very interesting because your chronological age and your physiological age, you cannot change your chronological age, but you can change your physiological age and be healthy for longer. And how do we improve with that? Well, as I said, we do a 360-degree health survey, a detailed health assessment, where in our clinic, we do DEXA scans. We do we control all of your functions, medical and physiological and neurological functions. And then we have an algorithm that is able to calculate what your body's overall health is and the ages. And this uses human and digital approaches, our solution does, for efficient health management. And it really does have a profound effect and impacts people's lives for the better. And all of this customer journey was built on Salesforce with the support and the background and know-how of SQLI. So it's a very successful approach, and thanks, and big thanks for SQLI for being the partner in this.
Pleasure. Now let's focus on how it works behind the scene. Why did you choose the Salesforce solution?
The Salesforce solution basically was, as a startup, we needed a cost-effective solution that avoided, I would say, hiring a team of developers. And so we wanted to use an existing platform, develop this platform and use a SaaS model instead of, as I said, hiring a team of developers. And also in Salesforce, we're able to benefit from the key technologies and evolutions that they have. For example, artificial intelligence.
Right. And what convinced you to work with us?
Well, SQLI, we needed the expertise in Salesforce. We had, I must say that we needed, first of all, people that knew how to develop on Salesforce platform this new idea. This is really because this doesn't exist elsewhere. We really put together with the SQLI teams an approach where we have the survey, which was very long. We had to get the onboarding digital inscription done too. We had to basically create on the Salesforce platform the whole customer journey, including the health assessment in our clinic and the follow-up and the coaching, and all of this was done really with SQLI's experience on that.
All right. And more recently, we built an AI agent together based on Agentforce. What does Sky offer to the users?
Well, I would say the AI agent is the last piece in the puzzle of our solution. And it adds value, and also it creates customer engagement. Because once you have, in our solution, you have the assessment, you have the coaching, you have some follow-up, but having an AI coach in your pocket that's basically available 24/7, and that knows you, that knows your medical history, that knows your medical condition, that knows what your preferences are, eating, sleeping, what are your physical activities? It knows everything about you. And so when you ask it a question, it's able to find that information and use a very, I would say, very elaborate data library that we created with SQLI to get the answer and make it very personalized. And it's I would say that it's very effective.
And for instance, what type of questions could we ask to Sky?
Well, let's say you have a very important meeting or an interview or a webcast. Well, then you say, how can I control my stress, or how can I relax? And it'll give you, according to your profile, different tips to use. You can also ask, how can I boost my energy according to my profile? And it knows what you like, what you don't like, and also it uses the latest information in medical and health technology and well-being to help you in this, because we're continually adding information, medical information, health information to our database. So it's really going to use the latest sources to help you on your health journey.
All right. And on the tech side, how did you collaborate with our team?
On the tech side, so I would say that SQLI's experience was really fundamental for us. We needed, first of all, because this is the first time, as I know, I don't think that there's other health coaches that exist on the Agentforce. So the team we had to create the agent on Salesforce. We had to define its roles, define the guidelines, what it could do and what it couldn't do. For example, it can respond if you want to, let's say, run a marathon in 6 months. It'll respond and give you, your program for that. But if you want to get some, if you want to get a medical prescription, it cannot do that. So anything that a health coach can do, it can do, but not a doctor. Then we created the data cloud database, so it has access. So the agent has access to all the medical data, all the lifestyle data, and as I said, all the documents and books and articles that we're continually, and scientific documents that we're putting in there. And then this team basically put into place the Salesforce action flows and builders to enable Sky to retrieve the information to respond to the users requested. So we trained it. We use simulations for the user cases to, I would say, to make it better and better, to improve it. And I would say it's like training a student with an IQ of 400, because at first it doesn't know anything. It answers sometimes really strange things, but then as you train it, as you guide it toward what kind of responses you want, well, it's surprising. And in only 2 months, SQLI and MyLifeCare, we came up and with this coach, and we were able to present it at the World Tour. It was amazing, really.
And for the future, do you plan other innovations to improve the user experience?
Absolutely. One of the best things I think that Sky is able to do is, and what we want to do is facilitate the utilization and engager experience. So what we're doing is we're putting Sky on WhatsApp. So anyone at any time, they can, instead of logging into their profile, they can ask a question on WhatsApp, and then Sky is going to respond. It's going to go into the databases and respond directly and immediately to what your question is. For example, you take a picture of your food and you say, is this good for me or not? And it's going to tell you, according to your health goals, what you should eat or not. But, then you don't have to listen to it all the time. So that's one very positive and very interesting approach. We have a version that's premium today that includes, as I said, the hybrid and digital versions that are, together. But now with the SQLI's teams, we're finalizing 100% AI digital version that's going to make it scalable to all companies, to all employees, including SQLI, I hope. And it's a very low cost and scalable model that is basically gives everyone the opportunity to benefit from this great technology. And so I'm very excited about that.
Yeah, great. All right, to conclude, do you have a final thought to share?
I would say this is a very exciting time in our lives. With health management and technology, we can really work to improve people's lives, work to even save people's lives. I would like to give really a big thanks to the SQLI's teams, notably Abel Atias, who's been on this adventure, this mission for several years now, and without we couldn't have come to this point. And also the teams like Ellie, Emily, Miriam, and Leah. And also SQLI's motivation to accompany in MyLifeCare in making this world better and making this, I would say, the mission of making people's lives healthier, which is a great mission to accomplish.
Yeah, thank you very much, Christine. And we wish a long life to MyLifeCare, to Sky, and to our collaboration.
Thank you very much.
Thank you again. Thank you.